Indeed, thank you for the opportunity to be here with you today for the launch of our World Health Day Information Toolkit. Ladies and gentlemen, World Health Day will be commemorated on 7th of April to mark the anniversary of the founding of the World Health Organization, which provides a unique opportunity to mobilize action around a specific health topic of concern to people all over the world. And as Dr. Nirvana has mentioned, the theme for this year's World Health Day is depression. Let's talk. And really, I think very apt and very timely. According to the World Health Organization, depression is a common mental disorder. Globally, more than 300 million people of all ages suffer from depression. It is a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. More women are affected by depression than men, and its worst, depression, as we've heard, can lead to suicide. And of course, we also know that there are effective treatments for depression. Ladies and gentlemen, adding to that, depression is an illness characterized by persistent sadness, loss of interest in activities that you normally enjoy, accompanied by an inability to carry out daily activities for at least 2 weeks. In addition, people with depression normally have several of the following symptoms. To name some: loss of energy, change in appetite, sleeping more or less, anxiety, reduced concentration, indecisiveness, restlessness, feelings of worthlessness, guilt or hopelessness, and thoughts of self-harm or suicide. Depression affects people of all age groups, all walks of life, and all backgrounds. It causes a lot of emotional distress to the person, affects their relationships with family and friends, and impacts their ability to earn a living. And it's worse, like we said, depression can lead to suicide. Ladies and gentlemen, the biggest challenge is removing the stigma associated with depression. Despite the awareness raising, there is still a large number of people who will not seek help due to the following: fear of social stigma, lack of understanding about what depression is, how it can be prevented and treated, and because of the illness itself, people tend to become withdrawn and more isolated. The overall goal of this one-year campaign beginning on 10th October 2016, World Mental Health Day, is that more people with depression in all countries seek and will get help. More specifically, the Ministry of Health and Medical Services, in partnership with our important stakeholders like the WHO, is aiming to achieve the following. 1. To ensure that the general public is better informed about depression, its causes and possible consequences, including suicide, and what help is or can be available for prevention and treatment. And that people with depression seek help, and encourage family, friends, and colleagues of people living in depression to be able to provide the much needed support. Depression, ladies and gentlemen, can be effectively prevented and treated, and that's a good thing. Treatment usually involves either talking therapy or antidepressant medication, or a combination of these. Overcoming the stigma often associated with depression will lead to more people getting help. Talking with people you can trust can be the first step towards recovery from depression. And thus today's launch, ladies and gentlemen, signifies the beginning of a year-long campaign for depression. Let's talk. As part of the campaign, the Ministry of Health and Medical Services is launching these toolkits to better equip our health professionals to recognize, prevent, and treat depression. They will also be able to use this information kit to advocate for prevention of depression and treatment in their respective communities and at all health facilities and hospitals around Fiji, in every nursing station as well, and our health centers are also included. There are in fact 2 sets of information packages prepared, one specially created for schools. Teachers and education professionals would be able to use this information toolkit to advocate for depression prevention and treatment, especially in our young children and adolescents. The information presented is used in an easy to understand and aims to encourage people to reach out and seek assistance, and not to shy away from talking about depression. By talking about depression, we aim to create a better understanding about this mental illness and educate the public that it is treatable and a preventable condition. A better understanding, of course, of this illness across all sectors will help reduce the stigma with it, and we hope more people will seek help and get the treatment that they need. Ladies and gentlemen, depression causes tremendous loss of productivity in an individual, not just at work, it also impacts on the relationships and functions. Many people do not seek help, and we hope that through rigorous awareness campaigns and with the support of our generous and not so generous media organizations, we will be able to break the silence to increase public awareness on depression, its signs and symptoms, and encourage people to seek assistance to live a happy and empowered life that each of us truly deserve. Through this campaign, the Ministry aims to increase its reach out to those who may be living with depression silently, encourage them that they are not alone and that there are platforms through which they can seek assistance to secure help. As a lead-up to the national celebrations on the World Health Day next week on Friday 7th in Suva, the following events and activities will be organized, and we appeal to all stakeholders, partners, public to help us maximize awareness on such programs to disseminate the vital information. Of course, our media partners, generous and not so generous included. Apart from the main event in Suva, those in Lambasa and Lautoka will also be able to commemorate awareness programs on the World Health Day. Lambasa and Lautoka will also mark the celebrations within the divisions. School projects, the Ministry has partnered with Youth Champ for mental health awareness, and I'd like to thank them for doing a tremendous job in regards to this issue, targeting 50 schools. Do we have a representative from Youth Champs for mental health here? No, okay, but we acknowledge the work that they do in this area, and they will be targeting 50 schools nationwide to educate on depression and how to access help, followed by a suicide prevention symposium to be held next week as well. There will be a mental health literacy research study being conducted as well, along with 4 NGOs who have partnered together with the youths to organize Zumba sessions to promote more youth-based mental health initiatives and interventions. And this is scheduled for Saturday, April 4th at YMCA. Ladies and gentlemen, this should not be the end of activities that we can include, so we look forward for the community support. And of course, should they feel that they need to be actively involved in our campaign, we welcome all to join us. And over the last 5 years, the Ministry has seen a steady increase in admissions as a result of depression in public hospitals, with a maximum number nearly 300 cases in between 2012 to 2016. We know that this is just the tip of the iceberg, because we believe there are so many out there who do not seek assistance at all. A large majority do not seek help and will struggle through life. We see more females presenting than males for depression. That is something for us to look at. Locally, most of our depression cases are young adolescents and adults between the ages of 15 to 19 and 20 to 29. This representation is also a reflection of our working population groups, which is quite worrying, as the loss of productivity due to depression impact across a lot of sectors. Ladies and gentlemen, the mental health crises are viewed differently because of ignorance, poor knowledge, stigma, and discrimination. We must not allow this to continue to happen, especially as we know that there can be no health without mental health. Family support are the caring units we have in the society. Thus, it is also vital. Also vital, and loved ones can play a big part in helping a person recover, work towards their goals to stay well and maintain good health and well-being. Care and emotional support go a long way in recovery and well-being of those who suffer from depression. So far too long, many have said nothing or almost complete silence on depression. At home, in the workplace, in our communities, sometimes it tends to be brushed under the carpet. I believe that time is over now. And it needs to be discussed openly and freely, because issues like depression is affecting our young lives, families, individuals, and holding back prosperity. So let's work together and join hands, and let's talk on how we can tackle and overcome depression. On that note, I thank you all for being here with us during our media launch, and I look forward for a successful celebrations in regards to this year's World Health Organization theme, mental health. Let's talk. Thank you.
Remember, it's not weak to talk about depression.